decades. We have different modalities of dialysis, like home hemodialysis, PD. Those patients, they get less of an issue with volume overload. So when you talk to your patients, you know that before you start jumping on medications, you try to reduce the weight. So think about that if your blood pressure is high, your weight needs to go down. And this is a very dynamic process because throughout the years, in the summer they gain more weight or they lose weight, or in the winter during the holidays they gain more weight. So you have to be very proactive. As a rounding nephrologist, I do this all the time. I adjust the weight based on the blood pressure and based how they feel. If they have any edema or any crackles, I need to adjust the weight accordingly. This is what I do. That's what we call like dialysis rounds. We go once a week, and one of the important goals is to find what is the right way for my patients. So blood pressure up, weight needs to go down. Blood pressure down, weight needs to go up, because that means that the patient is gaining solid weight. Are you guys following that concept? It's like a little confusing, but once you're doing this for some time, it becomes pretty straightforward. So these are the steps that I normally do to normalize patients. I prescribe more dialysis. Almost everybody doesn't want more dialysis, but if you're having an issue with hypertension, that means that you need more clearance. You probe your weight, your dry weight, so you go down. Sometimes you switch them to a different modality, dialysis modality. There's something called nocturnal dialysis. Those patients have great blood pressure control because they get a lot of clearance. They're connected to the machine for a long time. And ultimately, you transplant the patients. And transplant fixes the problem, because if your kidneys are not working, you're going to have a lot of hypertension. That's why I see hypertension as a secondary hypertension when you have kidney disease. All right. Questions, guys? Everything's good? Yeah. So you're from here?